Alrighty, and whenever you are ready, David.
Okay. Hi, my name is David, and I will be talking about lean enterprise within healthcare. Why did I choose this topic? Currently, I am volunteering at the Veteran Affairs Hospital, and I'm working on a project where we're finding out where patients are getting assigned to a primary care provider. We're using flow maps, understanding the whole process, eliminating waste, and trying to standardize the whole process. Some topics that I will be covering is what is lean, types of waste, Kaizen philosophy, some tools. I will also talk about an example of Pacific Clinic, and I will wrap it up with a conclusion. Okay, what is lean? Lean is the elimination of waste. The philosophy is produce what is only needed, when is needed, with no waste. The method is termination of value added in the process. Okay, the goal of lean is to improve quality. Today is competitive in the marketplace, so a hospital must understand its customers' wants and needs and design process to meet their expectations and requirement. Elimination of waste. Elimination of waste is any activity that consumes time, resource, or space but does not add any value to the product or service. There are 7 types of waste. Okay, reducing time. Reducing the time it takes to finish an activity from start to finish is one of the most effective ways to eliminate waste and lower costs. There are 7 types of waste. Overproduction. Production ahead of demand. Waiting for the next production step. Transportation, moving products that are not actually required to perform the processing. Inventory, all components work in process and finished product not being processed. Motion, people or equipment moving or walking more than is required to perform processing. Overprocessing, resulting from poor tool or product design, creating activity. Defects, the efforts involved in inspecting for and fixing defects. Kaizen philosophy is a tool of lean enterprise. Kaizen philosophy is an employee-led continuous improvement. No process can be ever thought as perfect, so operation must improve continually. Striving for innovation and evolution. There are 5 steps to Kaizen. Is identify specific value, creating map and improve the value stream, flow, pull, perfection. Okay, a tool of Kaizen is plan, do, check, act, or PDCA. Plan is define the entire process to be improved using process mapping, collect and analyze appropriate data for each element or of the process. Do, use improvement process tool to improve the process. Check, measure the results of the process improvement. Act, to hold the gains. If the process improvement results are satisfactory, hold the gains. If the results are not satisfactory, repeat the cycle. There are several tools for lean, such as standardized work, cycle time, throughput time, value stream mapping, flow and pull, and the 5S. Standardized work. When documentation of the way in which each step is a process should be performed, not a rigid system of compliance, but a means of communicating and codifying current best practice. Standardized can be documentation each and every patients are filling out, or standardizing a nursing closet so nurses can know where each and every equipment is located. A cycle time. Cycle time is the time to accomplish a task in a system. System cycle time is equal to the longest task cycle time in the system, the rate at which customers or products exit the system. Throughput time. Time for an item to complete the entire process, which includes waiting time, transport time, and actual processing time. Value streaming mapping is an important visual tool for lean enterprise. Value stream mapping is a lean enterprise technique used to analyze and design the flow of materials and information required to bring the product or service to a question. First, you have to identify the value-added steps, and you do this by asking the question, would the customer be willing to pay for this activity? And non-value-added steps is necessary and unnecessary. Okay, an example of a value stream mapping is this Pacific Clinic. Patients check in for 3 minutes. They wait for 15 minutes. They move to exam room for 2 minutes. Then the nurse do a preliminary exam for 15 minutes. Another wait for 15 minutes. Physician exam and consultation for 20 minutes. Another waiting for 10 minutes. And then the visit is complete. This is an example of the whole process of this clinic. The breakdown of this clinic: patients check in, cycle time is 3 minutes. The system cycle time for the longest activity is the value added physician exam for 20 minutes. The throughput time, which is the whole patient's check in to the visit being complete, is 70 minutes. But the whole value added task is the nurse exam, 5 minutes, the physician exam, which is 20 minutes, and the non-added steps necessary was the patient check-in for 3 minutes. The value added time for the actual reason why the patient actually came in was for the nursing exam and the physician exam, which was 25 minutes. As a result, 25 minutes is value added, and some non-value added, which was unnecessary, was the waiting time, and the patient waited at least 45 minutes, which we can probably eliminate some of the waste, so there will be more patient satisfaction. Okay, flow and pull: continuous or single piece flow, move items, jobs, patients, products through the steps of the process one at a time without interpretation or waiting. Pull or just-in-time: products or service are not produced until their downstream customer demand them. An example of just-in-time is where fast food, for example, they make it until you order it, so they can eliminate waste. And the 5S program. 5S program is another lean enterprise tool, and its 5S program key component is the visual workplace and a part of Kaizen. Sort: separate necessary from unnecessary items, including tools, parts, materials, and paperwork, and remove the unnecessary items. Straighten: arrange the necessary items neatly, providing visual cues to where items will be placed. Sweep: clean the work area. Standardize the first 3 S so that cleanliness is maintained. Sustain: enable that the first 4 S continue to be performed on a regular basis. As a result, 5S program can improve profit, efficiency, service, and safety. As in conclusion, the goal of lean enterprise is to improve quality and eliminate waste. The implementation of the lean enterprise, though trying to make value flow at the pull of the customer just in time, prevents and eliminate waste in your processes. There are 7 types of waste: transport, inventory, motion, waiting, overprocessing, overproduction, and defects. There are many tools involved in lean enterprise, such as standardized work, cycle, time, value streaming mapping, flow and pull, and the 5S.